I think the thing that makes us different than medical spas is that we have years of training in the skin and dermatology, and that comes from years of studying complications, seeing skin cancers, learning all the disorders of the skin. So not only are we doing Botox, fillers, etc., we know how to handle the complications, which I think is really important. And when we're treating the skin, we're comprehensive. So if somebody has a skin cancer, or somebody has a melanoma, or somebody has pre-skin cancers, we're not treating over them, which is something that happens. We have seen patients that have come from other places or medical spas who have had Fraxels or other lasers done, and they just are treating over their skin cancers and they're missing them. And that is not something that we are going to be likely to do. Even our estheticians who work with us, train with us during our skin exams, so they're actually more capable than most estheticians in other places to pick up on the skin cancers and on the pre-cancers. And our estheticians will often grab us out of our rooms to ask us if what they're seeing is potentially a skin cancer, and we can actually biopsy them right when they're in our clinic. I think the other thing that's important is that we see complications that happen from the procedures that we do, and you need to know how to manage the complications. And I think that many of the medical spas do not have the capabilities or the knowledge to handle the complications. And so we do see a good number of patients that come in with complications, whether it is necrosis or death of the skin from filler complications or compression of vessels, where we have had to manage that for different medical spas, or filler where patients have gone to even other countries, and we have had to surgically remove the fillers from the face because they were creating a robust inflammatory response in the patient's skin. And it was a filler that, I don't even know what kind of filler it was, could never figure it out. We're trained and we have years of experience. We train our staff well. We can pick up on skin cancers. We can manage complications.
As physicians and as dermatologists, obviously we have our entire medical background and also 5 years of training that really, I believe, sets us apart as far as really understanding the skin and the problems that somebody can have with respect to their skin conditions. So I think it really is an advantage to see a dermatologist, particularly a cosmetic dermatologist, that can really address all aspects of your skincare. Personally, I can tell you that as a skin cancer specialist and also a cosmetic dermatologist, I see a number of patients that come in to see me that want to address their skincare, their skin issues. And what I see is that they need to address, for example, their sun damage, and we will address a variety of medical treatments that we want to pursue first before they even consider any kind of laser treatment or any other treatment. So I think that's some aspect that can definitely be missed if a patient just sees someone who's an esthetician or just purely is in a med spa. In addition to that, I can tell you that there's been a number of patients that I've also seen who have had, for example, skin cancers that I've diagnosed that would have been very possibly missed if they just saw an esthetician. So I think it's the ability to really consider the entire health of their skin and not just a cosmetic visit.